Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about how smoking and tobacco affects your oral health. Let's start. So we already have established about the fact that tobacco and smoking really affects a lot of your body parts, especially your lungs and your heart and your kidney and your liver and your intestines and your digestion and so many other things. Let me talk about today about how smoking and tobacco, that is smokeless tobacco, affects your oral health. So we'll start off with smoking. To be very honest, we've already established that the leading number of causes for lung cancer, followed by laryngeal cancer, and then followed by oral cancer is smoking. Now, smoking can be done in various forms, that is cigarettes, cigars, BDs, and so many other sort of formulations. But the basic mechanism of action when it comes to affecting your oral cavity and the oral tissues and the oral mucosa still stands the same. Now, smoke contains a lot of chemicals such as nitrosamines, benzopyridines, hydrocarbons, and tar, that basically, because of the moist nature of the oral mucosa, these chemicals get leached in to the oral mucosa and thereby cause direct DNA damage to the cells. Now, this does not happen overnight or in just one cycle or in one episode. It keeps on happening with the chronicity and the repeated nature of the habit, depending upon the intensity, the frequency, and the duration. Intensity as in what kind of smoke you're inhaling, the frequency as to how much you're doing it in a day, and duration, how long are you doing it for one episode. So to be very honest, it's very difficult in today's world because we are all slaves to our habits. But knowing the harsh reality about the fact that smoking really does cause a lot of problems, especially around when it comes to interaction with alcohol, it provides a synergistic effect. That means the individual effects, the harmful effects of smoking and alcohol are much less compared to when they both are combined. Smoking not only affects your teeth in terms of reducing the salivary flow rate, that means your saliva, which has an anti-carious action, basically the composition changes, the flow rate changes, and you have a relatively drier mouth, because of which you are more susceptible to cavities. It directly affects the oral mucosa in terms of it can cause white patches, precancerous lesions, precancerous conditions, oral cancer itself, and on top of that it can cause other things such as periodontal disease, because of the fact that it really alters the microbial flora's oxidative the stress. It gets much more oxidative in nature, and the fact that it becomes more anaerobic, the temperature also increases, and the whole atmosphere becomes much more toxic, which is very good for harmful bacteria that cause periodontal disease and gingivitis and other gum problems. It is also known that it accelerates the inflammation in the bone. That means you are more susceptible as a person, matching all the other variables, that a smoker versus a non-smoker. A smoker will have faster rate of bone loss because of inflammatory mechanisms, and on top of that you will have other very day-to-day problems such as bad breath. You'll have stained teeth, which does not look very aesthetic, because anyone can tell by looking at your teeth and the stains and the dark stains on your teeth that you are probably a smoker. Not only that, not just when it comes to restorative treatment, obviously when it comes to implants, the implant failure rate is much more in smokers compared to non-smokers. But even aside all that about oral health, they are not very good for your cardiovascular system, your kidneys, your hypertension, stroke, heart attack, cardiac arrest. All these things can happen much more. These are very well established facts about smoking, and the fact that your cholesterol levels shoot up, your triglyceride levels shoot up when you're a smoker. When it comes to smokeless tobacco, they also have a very similar way of action, but they have a much more localized and at the same time much more profound effect on the oral mucosa, especially around tobacco, basically the pouch, tobacco pouch keratosis, leukoplakia, white lesions, erythroplakia, lichen planus, lichenoid reaction, burning sensation of the mouth, OSMF. That is one of the biggest problems when it comes to gutka. Gutka is the Indian or the Southeast Asian form of tobacco, smokeless tobacco, that is usually in the form of a powder, and you're supposed to eat it and keep it in one side of your mouth so that it gives you that sense of euphoric kick. However, that kick comes at a cost. because of the fact that it causes a lot of problems, especially around the Southeast Asian subcontinent, where we talk about OSMF, that is oral submucous fibrosis, which is a precancerous condition that causes you to have restricted mouth opening, burning sensation, your quality of life gets compromised, and you're not able to eat food properly, you're malnourished, and obviously malnourishment has a huge role to play in any sort of development of cancers, and especially oral cancer. So most of the oral cancers are actually associated with smokeless tobacco, that is tobacco leaves, areca nuts, gutka, mishri, zarda, all those things, even tobacco snuff for that matter. Tobacco snuff users have problems around the nasal mucosa, they can have cancers of that area, but to be very honest, it's very difficult to counsel patients about these things, because everywhere there is no sort of the only benefit, that I wouldn't even call it a benefit, just because we are so enslaved to our habits and our desires and our dopamine affinities. So that is why we end up compromising so much, because smokeless tobacco is very, very dangerous. The kind of cases I see about oral cancer are not something to be meddled with. Even if the oral cancer is detected at an early stage, you might have to go for surgery, you might have to go for chemotherapy, you might have to go for radiotherapy, and the compromise that happens after that in terms of quality of life is a lot. If you're undergoing surgery, unfortunately you lose a part of your bone, or a part of your vital organs in the oral cavity, and radiotherapy, chemotherapy has its own side effects. You get radiation mucositis, you get gastric problems. Also, smokeless tobacco affects all your mucosal areas, right? Your digestion as well. It gives you acidity, ulcers, intestinal disorders, and so many other things. So I would really recommend all of you who are probably indulging into these habits to try and put them to a minimum, try to lead a healthier lifestyle, and to try to quit this habit as much as possible. And that's what I can do. That's my social responsibility as your dentist and your doctor. The rest, the buck lies with you guys. And I think I hope that this video makes some sort of difference to you guys about how you need to take care of your own lifestyle and your life. So that's it for today's episode. Please like, share, subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. I will not pick up your call because I'm very busy. Just drop me a message and I'll get back to you within a few days, and probably after that we can have a chat. So that's it for today. Thank you.